Gallbladder 36 is located 7 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're having difficulty locating the anterior border of the fibula, just raise the leg slightly off the bed to allow the flesh to move away from the bone. This should make it easy to locate your point. Gallbladder 37 is located 5 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point. Gallbladder 37 is located 5 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point. Kidney 9 is located 5 cm superior to kidney 3 on a line joining kidney 3 and kidney 10. The channel is starting to move a bit more posteriorly here. Bladder 39 is located towards the lateral end of the popliteal crease, medial to the tendon of biceps femoris. To bring this tendon into relief, have the person take the weight of their leg. You should be able to feel a strong tendon at the lateral side of the popliteal crease. Put your finger on the depression that's medial to that tendon, relax the leg, and you've found bladder 39. Bladder 56 is located on the posterior midline of the lower leg, 5 cm inferior to bladder 40 in the palpable cleft between the two heads of the gastrocnemius muscle. Bladder 57 is located on the posterior midline of the lower leg in a depression inferior to the two bellies of the gastrocnemius muscle. To find this depression, have the person point their foot. If you can't see the depression, palpate round, feel the bellies of the gastrocnemius and the Achilles tendon and spiral round until you can find a nice dip. This point is often described as being 8 cm superior to the lateral malleolus, that is halfway up the length of the lower leg. It's not always there. Please go with a local anatomy to make sure you find this point correctly. Bladder 58 is 7 cm directly superior to bladder 60. It's often described as being 1 cm inferior and lateral to bladder 57. But that's not always the case. Bladder 61 is located halfway between bladder 60 and the sole of the heel. Feel for a tender depression on the bone. Bladder 65 is located on the lateral aspect of the foot in a dip which is proximal and inferior to the head of the fifth metatarsal. It's the knuckle of the little toe. Move proximally and inferiorly and fall into a nice dip. Once again, be careful not to mark this point too much onto the sole of the foot. It's on the side of the foot.